Okay, so now let's talk about pure tones with bone conduction. So we talked last week about air conduction, sort of what and why generally, and then air conduction specifically. This week we're going to talk about bone conduction, how you do it, and then interpreting the results of bone conduction in conjunction with the results of the air conduction thresholds. So just a quick review. The patient task for bone conduction testing is going to be the same. Their task is simply to let you know in some reliable way that they've heard the tone. The transducer we're going to be using is the bone oscillator. That's the only transducer that's capable of doing bone conduction testing. For test frequencies, typically we're going to test 500, 1,000, 2,000, and 4,000 hertz. Sometimes you may see 250, but I'm going to talk in a little bit about why it's not common. The audiologist's goal, again, is to find the threshold, to find the lowest, softest intensity value at which the person can detect the sound at least 2 out of 3 times. And then we're going to chart the thresholds on the audiogram. For bone conduction testing, we're going to use the same down 10, up 5 bracketing method as we use in air conduction. Vibrotactile responses are the biggest issue with 250, and I'm going to show you a diagram of those in a minute. There's not necessarily as strict a protocol for where to start with bone conduction testing, and you'll see people start at various different levels. Since bone conduction thresholds cannot be much worse than air conduction, and we'll talk about why that's true when we talk about results, it's fairly typical to start at your air conduction threshold and then go up or down in intensity, because 9 times out of 10 in a clinical setting, you're going to see air conduction thresholds obtained first and then bone conduction thresholds obtained at a later time. So it's fairly common to start at the air conduction threshold at that frequency, and then go up and down in intensity from there. So this is a vibrotactile response curve superimposed on the audiogram. And so what you can see, if you look here, what's drawn in up here is the bone conduction vibrotactile response line. And essentially what that means is this. When a sound gets intense enough, people can actually feel it as vibration. And it happens with air conduction and bone conduction, but it happens at much lower intensities with bone conduction. So, at 250 hertz, if you use the bone oscillator to play a sound that is 40 dBHL, right here, even if the person can't hear it, they may be able to physically feel the bone vibrator buzzing on their head. And they raise their hand, oh, yep, got it. And so this very low threshold for vibrotactile responses, especially at 250 hertz, is one of the main reasons you don't really see bone conduction testing at 250 hertz all that frequently. You also need to be aware of it for 500 and 1,000 hertz, where you may get bone conduction responses that are not true responses that are vibrotactile. And what you may see written on the audiogram is a bone conduction symbol and then VT or VT with a question mark or something along those lines. There's a bit of a controversy in terms of which bone conduction signal you use on the audiogram. You can either use a symbol that's denoting where you have physically put the bone oscillator. So if you go in the booth and you place the bone oscillator on the person's left mastoid, you may then choose to use the unmasked left symbol right here denoting that it was obtained from the left mastoid. Less commonly, and this I do not endorse at all, some people use a symbol denoting which ear they believe the response is from. But that is subject to interpretation and is probably the least accurate. You can also, or alternatively, use a symbol denoting that it is best unmasked bone. So, regardless of where it is placed, that it is a best bone symbol. And you will see that with this little up symbol like this. Alternatively, now these are the ASHA, what's pictured here are the ASHA recommended and sort of uniform symbols for the audiogram. Occasionally, and I'm not 100% sure where this has come from, you will see this symbol used to also mean best unmasked bone conduction threshold. So that's an option as well. I would stick with these symbols right here, again, because if somebody says, what is the symbol, where does it come from, you can refer them back to the ASHA guidelines for audiograms.